Hello, everybody. John Jones here with NuSpine Chiropractic. And today I got a special guest today, Dr. Jayme Chew, a lead chiropractor at one of our fastest growing clinics in the country in Downey, Southern California. Doctor, first of all, welcome. Thank you.
Hello. Thanks for having me.
Yeah, I'll start with this, Doc. What would you say to that person that was considering chiropractic care, but they were hesitant or concerned because they're pregnant? And then also maybe share a little bit about what you feel about the length of time, how many months in, do things change?
Absolutely. To answer that first part, it's a very common concern that I hear with pregnancies and mothers. I want to assure everyone it's very safe. There's plenty of different techniques to be used to allow us to treat a pregnant patient, and it's very safe and actually very beneficial for the mom and for the baby as they're growing. So I always recommend chiropractic care in pregnancy.
Yeah, and maybe you could elaborate a little bit more on some of the things that doctors like yourself do to change your approach for someone who's pregnant. Do you adjust as normal, or do you make some changes and so forth? How does that work?
So we have pregnancy pillows that have special cutouts for the stomach. So it's very comfortable for the woman to lay face down to do our assessments. Another way that we change our adjusting approach is I always try not to torque the pelvis too much. Really, the idea behind chiropractic in pregnancy is we're trying to alleviate any pressures that are going on within that pelvis, within the lower back. We're trying to change the tone of some of the musculature, make sure it's not as tight so the baby can grow fully and has enough room to move around. And we're trying to make the woman comfortable. We change the technique a little bit so that we're not torquing the body as much, so that twisting motion that you might see in some of those other adjustments. I try and keep the spine very straight as we do that adjustment. The technique that I employ is through the Webster technique, and so that's actually a certification you can do extra classes for, but it's based entirely around pregnancy and how to adjust safely, and it can even help in some cases of like breech pregnancies. It can help allow for movement of the baby.
Tell me, what are some of the things that pregnant patients have told you that they really have benefited from it? And then what are some additional health benefits people might not think of?
Some of the biggest ones that I find with pregnancy, so low back pain is number one. Often sciatica can develop as well. So those are the big ones that I end up treating most of the time. Mid-back pain, just from the way that the mother might be compensating. So that extra weight that she's carrying takes its toll. And often we even have carpal tunnel syndrome that develops in there. And some of the lesser known things, a lot of women don't realize that breech pregnancy can be helped through chiropractic, and any complications that you're having, we can help alleviate some of those symptoms and often help in ways that you wouldn't expect. There's almost always something that we can do to help. If we have to change our approach to treatment, I do that often, depending on what the patient is presenting with, what other comorbidities they have. Always good idea to have that conversation, be open with your provider, because you'll never know unless you don't ask.
Thank you so much, doctor, and thank you so much for your time and sharing your insights today. We really appreciate it.
Of course. Thank you so much, John.